the last part of my presentation is around the treatment of ADHD. So how do we treat ADHD? So it's not surprising, I think, to note that basically when it comes to treating some mental or neurodevelopmental conditions, we have two big options, the pharmacologic and the non-pharmacologic treatment. So when it comes to medication, we have two big groups of medications for ADHD, the so-called stimulants and the non-stimulants. Now, parents often get confused because they say, so wait a moment, doctor, my child is very hyperactive and you give him a stimulant. So doesn't make sense. Actually, these are medications that stimulate the parts of the brain which don't work well. So it makes sense in a way. And this in turn includes methylphenidate, which is the molecule, the name, the scientific name. It comes in brand names such as Ritalin, Concerta, Equazim, Medikinet, you may have heard of this. And the other group of stimulants is amphetamines, such as lisdexamfetamines. It comes in brands such as Elvance or other types of amphetamines. So stimulants are considered the first line. So first line means that prescribers should always consider them as a first option unless there are reasons to use non-stimulants. And the reason why they are first line is because they are in general much better than the non-stimulants in terms of effectiveness, so to improve, to decrease the severity of symptoms. Actually, within the stimulants, methylphenidate should be considered really the first choice because even if it's slightly less effective than amphetamines, it is better tolerated, so it has less side effects. When stimulants don't work well or they are not well tolerated, they have side effects that we can't control, then it makes sense to use a non-stimulant. And these include medications such as Strattera, atomoxetine, molecule name, and guanfacine, Intonim, the brand name. But these are really should be really considered a second choice. And sometimes parents say, well, actually, I tried this and it didn't work, so I don't think that the medication for ADHD works. Actually, they should try also stimulants before ruling out the possibility of a treatment. I would like briefly to show you this figure, which is important to understand this. So this figure reports here a series of dots. You see here in blue, there are dots which refer to medication used in psychiatry for mental health condition, and this white dot refers to medication used in general medicine. So the dot represents what we call in technical term effect size, which is a number basically which tells us to which extent the treatment works well. Now you see that in psychiatry, the medication with the highest effect size are stimulants. Actually, they have an effect size of 1, so it means they work well. So stimulants are the most effective medication we have for mental health conditions, much better than antipsychotics, antidepressants, and so on and so forth. In medicine, there are some medications which are really very effective, but in general, as you can see, stimulants here are quite effective also compared to general medicine. So bottom line is that stimulants for ADHD are not only the best medications in terms of the effectiveness that we have in psychiatry, but they are also among the most effective medications we have across all medicine. Now, of course, they may lead to side effects. This is not surprising. If you take paracetamol and you read in the notice, there are a number of possible side effects. Now, the two most common ones are decreased appetite and sleep onset delay. Now, it is important, I think, to highlight that in the majority of the cases, I'm not saying in all cases, but in the majority of the cases, we are able to manage these side effects, or they are temporary. So we don't need to stop the medication if it works well because of this. It would be a shame to stop the medication which is working well because initially the patient presents with this side effect. There's been some concern that this medication may lead to problem in terms of decreasing weight, height, so impacting growth, and also increasing blood pressure and pulse. So this may be true, but for a very small number of individuals who are treated with this. But we need to monitor this. So this is the reason why before starting the medication and during treatment in general every 6 months, we need to take weight, height, and blood pressure. Now, so far I have been talking about pharmacologic options, but as I mentioned, there are also non-pharmacologic options. So the most commonly used are behavioral strategies, which are delivered via parent training in groups or individual to parents. So actually, we don't treat the child, we treat, so to speak, the parents. So actually, what we understood by a series of important research studies that have been published recently is that possibly these parent training programs are not effective to change, to improve the levels of attention concentration of the child, but they're very important, very helpful for parents to, in order to learn how to cope with the child, and particularly with challenging behaviors. So ideally, we should offer a package. So the question is always the controversy: should we treat these children with medication or with parent training? The answer is, ideally, for the majority of the cases, we should offer a package of treatment which includes both pharmacologic and non-pharmacologic treatment, because they target different aspects, but they are all important in the functioning of the child and the family. You may have heard that there are also other possible non-pharmacologic treatment. However, I would like to make it clear that so far there is no solid evidence to say that, for instance, diet treatment works well for ADHD. They may be helpful for a very selected number of children, but usually they bring quite small effect. Also, there are other treatments that have been proposed, such as cognitive training. So, training your brain doing exercise by a computer, or neurofeedback, so changing the waves of the brain via feedback, which is provided by a computer. But all this is quite experimental, and there is no evidence basically right now to recommend this in the treatment. So this is important because you may read on the internet, some companies may advertise this as a treatment for ADHD. And finally, I would like to conclude this training with a couple of possible future treatments that right now are still a matter of investigation. So the first one is what we call external trigeminal nerve stimulation. So the trigeminal is a nerve which goes here and goes to the brain. And a couple of years ago, the FDA in the United States, so FDA is an important organization which basically is in charge of licensing the drug, so to provide the license to say, this drug can go on the market, but also non-pharmacologic device for the treatment of a number of conditions. So they found that this machine, which provides stimulation to this brain, seemed to improve ADHD. However, this was based just on one study, so we think that it's still early days, and we need to assess this better. And I'm pleased to say that we got a research grant here in the UK to investigate this, and Southampton is part of this. So in the future we may know hopefully more about this, which may turn out to be a possible alternative, even if the effect they saw in the initial study was not as big as the effect of the stimulant. So it may be an alternative for some families patients who don't want medication, or they can't tolerate it. But it's still quite early days. And finally, you may have read more recently, it was on the press, that the FDA once again approved a device based basically on video games. So this, in a way, is a kind of cognitive training. So you train the child to pay attention and to be able to inhibit the reaction via video games. So once again, the question is, why shall we bother with medication? Shall we treat this with video games? Now, we need to pay attention to how the message is delivered, because actually what they found in this study, and once again we are talking about just one study, so probably we would like to see more, is that this improves some measures that we can measure with some neuropsychological tests, but this has nothing to do, so it's not the same thing actually of the behavior of the child. So this video game led to an improvement in some neuropsychological tests, but this is not always perfectly related to the behavior of a child, which is the thing that we are interested in. And so we should be cautious in stating that you can treat ADHD with video games. Right, so that was it. I think, as I mentioned, this was meant to be a basic training. There may be other future trainings more on specific questions, but I hope it was helpful for you. Thank you for your attention.